So today I'm going to talk with you about food aversions. So a lot of individuals with autism struggle with some type of feeding issue. It's very, very common. Because of the level of sensory input we get from our mouth when we're eating and our nose when we're smelling foods, there's a huge system overload, if you will, from input when we're trying to talk about eating foods or smelling foods, cooking foods, handling foods. There's lots and lots of sensory input going on with that. If you have a child with autism that struggles with feeding in any capacity, I encourage you to do some training on that. Very interesting stuff, but very informative and very helpful. I've done some, and then also I've worked with my son's OT and speech therapist, as well as behavioral therapist, on these specific issues. So feeding aversions, food aversions can be very extreme. So I have a picky eater. I'm a picky eater in a lot of ways, but someone with food aversions literally can't handle certain foods. They can't handle certain smells. It sends their system into a complete overload. There may be gagging, there may be vomiting, there may be like screaming and running from the table or running from the room. Lots and lots of issues with smells, with touching foods, with handling them, obviously. And then of course that's not even counting the sensory input you get when you touch it to your lips, to your tongue, and it's in your mouth, and then you taste it, and that whole combination of senses there. So just please keep in mind when dealing with others with autism or families, there may be some pretty extreme food issues going on there. So best of luck with feeding. It's not a fun therapy thing for us. It hasn't been, but so far we are making great progress, and I'm very encouraged for my son and our family, but also for other individuals that struggle with this. There are therapy options out there, and they do work.